Welcome to our Age Naturally 2018 launch event. Let's get started. We have some very special guests here with us tonight. We have the founders of Derm Young. Dr. Yang Brooks and Dr. Serena Elmariah are here with us from Boston. They both are actually instructors at Harvard in the dermatology area. So they will tell you all about our new Derm Young line and all the benefits of that. We're very excited to have them with us. It is so hard to get two very, very busy people like them. And Dr. Elmariah is going to have to leave and go back to the airport to get back. So we'll get to her here in just a second. A lot of you know Dr. Thompson. She's actually our delegating physician here at About Face Skincare. So she's the one that helps me write the protocols for what we do, helps us with orders for any prescriptions. We don't do a lot of prescriptions here, but in case somebody has a little cold sore, needs an antibiotic or something like that, she's on staff to help us with any complications that we need. And of course me, just told you about myself, I'm Chrissy Thomas. So I wanted to first give you the about face statement on anti-aging, because sometimes we'll run into maybe a comment on Facebook or something that someone says, well, I don't believe in what you do. I am completely against anti-aging. I would never do any of that stuff. And to that, we all say, the whole staff says, that's fine, and we support that too. We're here to make you feel the very best that you can feel about yourself. And there's not very many people that come to see us that say, I want to look 25 years old again. 99% of our clients come in the door and say, you know, I just want to look, I am 65 and I want to look the best 65 that I can. And that is what we like to represent. If you ever see anybody that has a little more than you would want, that's because that's the way they like it. And we have to make them happy too. If you see somebody and you think, really, you go to About Face? That's the way they like it. They might like to just have some very gentle procedures done. So we are here to help you be the best you that you want to be. This is the lady on the handout I want you to see, the two ladies on the handout I want you to see. It's the third page of your handout that was in your goodie bag. So Allergan did a study, or did sort of a photography session with these two women. So this is actually a daughter who's age 26. Whoops, I'm blaming myself. And the mother is age 64. And they're genetically very similar with their face structures. So this was a great demonstration for what we're doing tonight. And I was online trying to find, because I knew we had done some studies like this before, and realized I had this in the office. So I actually have this if you guys would like to look through the book. But just studying the way the face ages, this is a nice case study to follow. So when we're younger, no matter what our face shape, we all enjoy this triangle of youth. And you can see the face is typically broader in the midsection and comes down to a thinner point at the bottom. Even if you have a very round face or a square face, you'll notice that it's going to be nice and full in the cheeks, and it gets a little bit thinner as you go down to the lower face. The cheeks are usually fuller, lips are usually fuller, and then we taper into a nice, strong jawline. And as we age, we see that it's almost like the balloon is deflated. And there's a lot of things going on under there. It's not funny. It's not even sad. It just is, and we can fix it if we want to fix it. But we see that we lose volume for a variety of reasons in the mid-face, and everything just tends to go southward. Now, Mom's lips actually look really nice, and I haven't read to know if she's had some intervention on her lips, but typically we'll see that upper lip in particular rolls down and in. So people will say, my lips have disappeared, and we say, no, they haven't disappeared. They're just sitting inside your mouth, and we just need to pull them out. So these are the changes in bone structure with aging. So this is one of the factors that we see in causing that deflated balloon effect. And you'll see in the 35-year-old, you see that ridge of her bone there above her eye. And that's where we see that real dramatic, nice eye that we see on youngsters, that you can put that pretty eyeshadow on the Instagram and see that nice brow bone. You see the malar ridge, or that cheekbone, is very full on the 35-year-old, getting a little thinner on the 45-year-old. And you can see that lateral ridge there is just not quite as full because that bone is already starting to disappear. And we can see the jawline. If you look at the jawline on the 35-year-old, you see it's starting to recede on the 45. And by the time we're 55, we see that that bone has receded insignificantly. And that's the scaffolding for which the tissue will suspend, from which it's hanging. So that's why we start to see a looser jawline. So if we look at mom and daughter, we see a very supple cheek, and we see where her bone is starting to break down a little bit right here. We see the brow is much more dramatic there than on that side. And we can see that they have a full face, but you can see that that jawline is nice, and mom's jawline is getting just a little bit softer. So this is the muscular changes with age. We move our muscles so much that we start to see creases in them. And we also lose muscle tone with age. We know that no matter if we're working out at the same rate with the free weights, that our muscles won't be as full and strong as they are when we are younger. The same thing will happen in our face. So you see how her eye is so tight here. She's got a lot of nice muscle fibers around the eye. And you can see here how her eye is more open because she's lost tone of the muscle around the eye, and the eye is just a little bit more slack. You can see that she doesn't quite have she has that nice rich contour, nice muscle fibers in the face there, and they're a little bit softer and thinner here. And then if you look at the jaw, this one is pretty amazing to me, how much muscle mass we have here and how little muscle tissue she has right there. And that's a big aging spot. This is the first place people typically notice. A lot of people say this is their first, but this is typically the first one that we treat. And if we look at mom and daughter again, you can see exactly what we're talking about. The eye is hanging open just a little bit more. You can see that she's not quite as full in the cheek. The cheek muscle is ending right there. And over here, her cheek muscle is swinging a little bit lower. And you can see the slackness in the jawline where this side is still pretty strong. She's showing that she's a little weaker right there. And this is the big one. This is the fat pad changes with aging. So this is the part that keeps the tissue lifted up off the bony structures, and that's what makes you look young. If you think about a 16-year-old girl and how she's got that supple, soft face, and then you think about somebody that's 55 years old, how even if they have a fuller face, they don't have quite as much supple padding. So particularly you see the temples, how they get very thin. And this is what people call peanut head. When people start to lose their temporal fat, it makes a peanut. See, it goes out, in, and out. So people will, I actually had a woman that said, my husband said it looked like peanut. I need to fix it. And that's what I really, that's before I'd heard the term, said, what do you mean? And yeah, he's in a coma. You see the tissue under the eye? You can see the trough right there, and that's primarily because of that muscle loss and because of the fat pad breaking down, and we're going to see that on mom in just a second. And then, of course, you see all this yellow. It starts to dissolve and break down. So if we look at mom, we see that trough I was just showing you there, and we see the deflated balloon. That's the volume loss, and we see how that tissue is now hanging. So tonight, we're going to talk about some techniques for reversing aging. Now, my granddaddy is a very good-looking 89-year-old man. There is no denying that. But you can see how my sweet 16-year-old, you see the light reflection on her forehead. Now, granddaddy uses really good product, so he has great skin. He's an about-face customer. He's very proud of that. And you can see he's got a little light reflection for an 89-year-old man. He looks really good. But you can see how he has lost a lot of tissue in the mid-face, has a little bit of slackness. You can see how this little cherub face is just nice and supple and rosy and full of youth and mischief. So I want to talk for a few minutes about our non-surgical facelift. There's a few of you in the room that do our non-surgical facelift. It is what put us on the map at About Face Skincare. And just to give you a little bit of history behind that, when I started the business in 2002, Oprah was really big, and everybody in this room would have been watching Oprah at 4 o'clock in the afternoon every single day, and I was going to hear about it the next day. And so Oprah got on her show and she said what she does for anti-aging. She was terrified of surgery, would never do it, but she did microcurrent facial toning every month. So everybody started, I don't even know, could we Google back then? I can't remember, but everybody started looking into the non-surgical facelifting or the microcurrent facial toning. Well, I was from plastic surgery. I had a plastic surgery background, and I'm doing chemical peels, but I'm listening to all these women that say, I will never trust anyone like I trusted Dr. Lieb and Dr. Peel, so I don't know what I'm going to do to keep my face lifted. And it just dawned on me that is a non-surgical option that I could offer that would give these women some lift in their face. So I found somebody to train me in Atlanta. Nobody was doing it in Atlanta. All my peers thought I was crazy because it takes 40 minutes to perform a treatment. That's actually what Sona is doing here because we want to show you guys something. So it takes 40 minutes to perform a treatment, and it didn't bring in the money that all the lasers were bringing in, and they thought I was nuts because 15 minutes and they were doing great. But they were tightening skin. And while skin tightening is very important, nothing is going to anti-age a face like tightening those muscles back. We can't do anything about missing bone. We can fake it with filler. We can fix dissolving fat pads with filler, but we can't mimic muscle tone unless we lift the muscles. You saw how on mom, the muscle was sitting very low, and on the daughter, that muscle was sitting nice and high. So when we lift the muscle, we actually bring back the upper lip. We can lift back the eye, tighten up the lower eye. It's going to shorten muscles that lengthen over time, like our cheeks and our forehead. And it's going to lengthen muscles that shorten over time, like our frown lines, our corners of our mouth here. Those muscles get really tight with age. So it dawned on me, I could do this glycolic peel that I'm doing, and I could add microcurrent. So I'm smoothing their skin and I'm tightening their muscles. And then it dawned on me, well, why don't I use red LED light therapy, which is not going to hurt anybody? A couple people would be contraindicated, but it's just red LED light and it evens out skin color. So I added that. And then I thought I need to tighten skin, so I added radio frequency contouring to my program. And thus, I have my non-surgical facelift. So about 7 years later, I'm sitting at my desk and I open a dermatology journal and it says, hey, if you layer microcurrent with LED and exfoliation and contour, you've got a facelift type non-invasive procedure. And I thought, great. I've been doing it for 7 years. I could be living in Tahiti, but no. So our non-surgical facelift will smooth skin. It will even out skin color, tighten your pores, increase muscle firmness, and increase facial skin tightness. We all think of these women as the ageless women because honestly, we all age. This is not a miracle, it's not a facelift, but it is amazing how much better these women look over the years, the longevity. When you do this treatment, we do see you 2 times a week for 6 weeks because just like we couldn't come in and lift one of those free weights one time and make our muscle pretty, we have to train those muscles to be tighter and firmer and stronger. So it takes 2 times a week for 6 weeks to really build that muscle tissue. However, we're able to maintain it with 1 treatment a month thereafter. So you just come in for basically a facial. There's no downtime and there's no pain involved with this treatment. Sona is actually working half of Devlin's face so that when she gets finished, you're going to be able to see the difference in the 2 sides. Here is a patient of ours, Miss Linda, and you can see, keep turning that backwards, see the trough there, see the disappearing upper lip, see the fuller lower face. Now, Linda went on vacation. She got a little tan before she got her after picture, so she got in some trouble from that, but she looks great. Eyes are a little bit more lifted. You see her cheeks are certainly lifted. You can see that the trough has disappeared. And you can see that she actually looks like she's lost 10 pounds. And it's because we took all of that tissue and we lifted it up where it's supposed to be. That usually happens. People will say, did you lose weight? Because you have lifted everything back where it goes. The really thin people, they're totally confused with them. They just say, did you change your hair? Now, this is a photograph I'm so proud of. I used to take pictures with a big Polaroid macro camera. It was a medical camera. If I put the white polka dot on your nose, I got the same picture every single time, and then Polaroid went out of business. So I had this customer in my office recently, end of last year. We were talking about maybe she wanted to shake it up a little bit and do some other things. Can you see, Pat? And so I was flipping through a chart and I said, oh my gosh, we still have your original Polaroids in here. Let's look. So you can see how she actually looks better in many ways 10 years later. And that is from doing her initial boot camp and continuing every 4 to 6 weeks, coming in and having her one facial. So that just validated my whole career. That picture, I was so happy to see that. So let's take a break here. And Sona, are you ready for us to see Devlin? Okay. So Sona has been working the microcurrent on the left-hand side of Devlin's face. So when she sits up, everybody responds a little differently. You should be able to see that one side looks better than the other. Just doing this one treatment, she would see this effect for the evening, maybe tomorrow. But it's the longevity doing this treatment 2 times a week for 6 weeks that we would see. Oh yeah, look at that arch on that eyebrow. If you stopped doing the treatments, you'll get loose immediately, but it's usually 6 months later when these customers come in saying, oh my gosh, I don't know what happened. And I'll look in their chart and say, you stopped your non-surgical and you're just now really starting to feel it. It takes a while for the muscles to finally just go back to where they would have been. We're going to start talking about PRP for hair rejuvenation. So Sam has been my supermodel for PRP for hair rejuvenation. Sam was slick bald on top. Well, he had a few hairs. It won't work if you don't have a few little hairs growing, but he really had no hair. We went through 4 treatments where we would draw a little blood. Oh, Lord, with lots of carrying on and drama. We would draw a little blood, inject it back in his head, and he actually has full coverage. He's not bushy-headed, but he actually has full coverage. He's excited. And I was talking in the earlier event today. I asked him last night, are you happy that you did this? Are you happy with it? And he said, yes, I'm happy, which is a big statement. So what we're talking about tonight is the vampire facelift, which I am not crazy about the name. It doesn't really fit our practice. It's actually called a PRP facial and facelift. But Dr. Runnels took a lot of time to create this vampire facelift, so we're going to give him the credit. And the vampire name is actually the most Googled anti-aging procedure over Botox and any of the others, which I find fascinating because other than the Kardashians, I really didn't realize that it had been studied that much. So Kim Kardashian did make this famous when she put out the photographs. And if you guys go home and Google it, you are going to see some of the most, my customers were telling me, and I thought, what? So I looked it up. There's nothing bloody about this procedure other than we draw a little blood from your arm. So the photographs that you see with these faces covered with blood and injecting blood, it's not like that at all. When we draw, the red blood cells are actually separated out. So this is trash. We don't use anything red in the treatment. We actually take the part that's been separated out, that's gold. So this is the part that's full of the platelet-rich plasma. And this is the part that's going to make your body do what it did 20 years ago. So that's the part that's going to make hair that has forgotten how to grow, that's now real thin and shedding, it's going to make it thicker, and it's going to make it not shed, and it's going to grow new hair. If you inject it in your face, you're not going to grow hair because you didn't necessarily grow hair on your face 20 years ago. No, but it's going to make your face look younger because it's going to help it grow new collagen and grow new blood vessels. Now, when you're doing the true vampire, you follow the protocol that Dr. Runnels set forth, which you have to watch out for. If you're shopping for vampire, you have to make sure that you're going to somebody that's doing the true vampire facelift. We can take that PRP and inject it in your face, and you're going to look better. It'll make you look fresher and brighter and grow some new blood vessels, but it's not going to do what it would do if we add just a little bit of calcium chloride to the syringe as we're injecting. Is your model getting cleaned up? Okay. Okay. So whenever we add a little bit of calcium to the syringes as we're injecting that PRP, it's going to give it a matrix to grow those new tissues on. So you're going to get more volumizing. Susie, come on up. So Susie was, So Susie was our morning, Susie was our morning model. And can I pull your pictures up from this morning?
Lord, I guess.
Oh, this is so exciting.
It's the outfit they put you in that's so wonderful.
Let's see. This is the fun of doing live events and when you do 2 in a day, you figure out what you want to say from the morning. Let me see if I can just put Susie up there. No, it's gorgeous. So Susie is one of our clients that we take care of. Sam, can you get this up on the screen for me? You're going to be a lot faster. Susie is the hostess of Atlanta's Best New Homes on Saturday morning at 11? Mm-hmm. Yes.
9:30.
So she can help you with all of your housing needs while we're getting her picture up.
That's right.
But because of that, guys, since we take care of Susie, it's very important to me that she doesn't look fake, because that's my name coming up after her segment on TV. And if they think she looks like she's frozen and can't move, it looks bad on me. So something like the Vampire is perfect for Susie because we can fill in troughs, we can make things soft. We're not freezing her with Botox. Oh, you need my face? Is she up there? Okay. Sorry, everybody. It says stop mirroring. If I push the button on my face, it's going to stop. Okay. It's not going to matter if you put it here. Forget that HIPAA compliance thing.
That is not me. That little naked man is not me.
All right, so you can see, if you look at this, and take your glasses off for us, Susie. Look at her tear troughs. So,
I don't have anything on. I mean, I went home and I still have a little eyeshadow and mascara, but I'm totally clean.
yeah.
What'd you say, look at her what?
Her tear troughs. Look here at the see right there? That's the part in the corners of her mouth. That's the part I really wanted to get for her because I couldn't get the, you can't put filler there and look natural, but you can put the PRP up to the lash line. And to be fair, some of that will relax down and then it will start to grow collagen and come back. So she will enjoy this for a couple days and then it's going to not look quite as great. And then 8 weeks later, she's going to start to notice because we need time for those tissues to develop. But you look great. 9 months to a year. You know, it's like everything else. We hear consistently 9 months to a year. All right.
It's awesome.
I'll let you off there. And how on a scale of 1 to 10, how painful was it?
I honestly, I've numbed for a long time.
Yeah.
So there was a little bit of discomfort when they did this part for some reason around my nose, but the rest of it I didn't feel.
That's okay.
I didn't feel it.
Okay.
So it was great.
Okay. And thank you, Susie. And we're going to work on Lisa a little bit here. And I do respect that we're eating dinner and not everybody is crazy about needles and things like that. So just watch the screen and let us know if we need to give you a cookie. So whenever you do the true vampire facelift, guys, we use a syringe of Juvederm. 1 syringe of Juvederm. And we're going to mimic some of that bone loss that you've had. So we're going to give you just a little bit right here on the brow bone. And it just gives you back that dramatic brow. We do just a little on the cheek. And we do just a little on the corner of the mouth, just to volumize and bring that back up. So we're filling in some of that volume loss. This is somebody getting the vampire. So we take the additional PRP that's left over and we go ahead and include the vampire facial in the vampire facelift. So the difference is the facelift is when we're actually injecting PRP beneath the skin. And the Juvederm beneath the skin. The facial is when we're microneedling into the surface of the skin. Okay, so we automatically add that PRP microneedling into the skin. We're addressing the deeper layers and the outer layers. The facial is typically sold independently and not performed with the vampire facelift. So that's where we just give you a little extra tweak. It usually costs about $9.50 to do the vampire facial on its own. And I want to talk about discomfort. Susie told you it really wasn't that uncomfortable. Lisa has been numbing. We have incredible numbing cream. So Lisa's been numbing for a little while with that, and that's what we do typically for our customers is put that numbing cream on, let you just hang out and read a book or something for a few minutes. We also have our Pronox system, which is laughing gas. That's fairly new to us. We've had it a few months now, and several people have enjoyed it, including Sam. That's the only way we got through our hair treatments together is his using the laughing gas. Where you go to the dentist and it's like a 70-30 nitrous and you get really sleepy and they have the mask on you, this is self-patient demand. You can get a hit if you need it, and you can put it down if you're fine. If you start to feel a little anxious or you feel like you need another sip of gas, you take another little sip. It takes a couple of minutes. It probably takes 10 minutes to completely clear your system. We're not going to let you drive till we know you're okay, but we've never had a case of somebody not being able to leave us because they're not completely feeling fine. It's like having 2 big glasses of wine and not getting any calories or a headache. It's awesome. And so I'm going to show one of my models who's actually in the room, Joy. So Joy was one of my first vampire facelift girls, and to be honest, when we brought in PRP for hair restoration, I wasn't going to bring in the vampire facelift because we didn't need it. I didn't think we needed it. We have all these great things we're doing already. But then I had situations arise where it's like, okay, I need something different, and this fits the bill. So with Joy, we have been doing some filler, and then we just had a point where we didn't want to use filler, but she wanted to change some things. So you can see, and on this, I think she actually looks a little bit redder, but it really brightened her complexion. You can see the incredible lift she got. And no, this is 8 weeks later. So Joy, because we were playing with the protocol, and I hadn't yet followed through with Dr. Runnels' protocols, I actually did several on Joy, but this is after her first one. So I didn't see any more amazing results after the first one, and then studied him and realized we really didn't have to do more than the one. Now with Joy, we did not use the Juvederm, so she didn't have the filler, but we did do the PRP. She looks great. She still looks great. And are you happy, Joy?
I am happy, but today is not a good day to look.
Joy. And she still looks great. She still looks great. And so I'm going to turn Joy around a little bit here so you can just see and she got an incredible lift. She really did. I don't sell this as a lifting procedure. I sell it more as a freshening and brightening procedure, but you do see lift with it. And Joy, I'm going to out you. You're in your 60s, right? 65 years old. Now I'm going to show you, this is a 49-year-old. And this is a month after, so she is still cooking. She couldn't be with us tonight, but she is not at her final stage yet. But you can see, and I don't know if you guys can see as well, she had a lot of brown spots that she was starting to develop. She's always had porcelain skin. She's been a client for years, and the sun damage was just starting to catch up a little bit. And she said, I don't like this. I don't like around my eyes. She was a perfect candidate for this. She's very natural, didn't want a whole lot of stuff. And you can just see how it is brightening her face. Yes. Use Juvederm here, here, and here. The vampire protocol. Now, if you came in, I say that, but if you came in and you did not need anything here, you did not need anything there, just because it's the vampire protocol, we're not going to do it. We're going to customize it to you. But she was perfect for the standard protocol. This is the front. See, you can see how it lifted, and she's not complete yet. Yeah, so it's exciting, very exciting. This next customer is one that had several treatments that we offer. She'd had Fractura. We'd done everything we could for her neck, and she said, Chrissy, I just am not happy with my neck. And I said, well, we're playing around with this vampire deal. Let's see what it will do, because this is when I was still kind of skeptical. And this is one treatment 8 weeks later. So you can see it really helped that crepey tissue. And she was here yesterday, and she says, I am still so very happy with the way this looks. This was actually several months ago that we did her, and she was still looking great yesterday. She did not do her face. We just did her neck. You can see a little bit of difference in her face, though, and it's just because you put that PRP underneath the skin, and it's not going to just stay where you put it. It does travel. So eyebrows sometimes start growing a little better. It's funny. It's all the things that your body used to like to do. So Mary is right now working with Lisa. She's putting in the Juvederm, doing the little bits. Lisa, you feeling okay? All right. And you know, while they're working, I'm going to continue talking just because I don't want us to get behind. So I'm going to go ahead and tell you about another new device that we have that we're real excited about. We brought in the Osmosis product line about a year, maybe year and a half ago. Osmosis is a very natural product, but a very effective product. And what happened is we started realizing we have more clients going through chemotherapy, more clients with autoimmune diseases, rosacea, very sensitive skin, and we didn't want to have to think, okay, we can't do our normal product, our normal facial product line. What are we going to do? So we started realizing we had a true need for an oncology aesthetics program here, and we are very excited. I'll call out our program. It's called Sidestep, because we're taking a little sidestep in our normal routine of life whenever we have to deal with cancer and chemotherapy and radiation and things like that. So our Sidestep program was founded last year. And I'm very proud to say that other than in the very beginning, nobody's ever had to pay for their own Sidestep oncology facial here because it's been supported by you guys. And that is a really rewarding thing for us. When we have events here and we charge for tickets, the ticket money goes towards our Sidestep oncology program. Occasionally we'll have somebody that comes by the desk and they say, you know, I just would like to pay for some of the oncology facials just to put them in the bank for those that need them. So we really appreciate that. That will happen out of the blue and it just blows us away. And that means a lot. Nobody's ever had to pay for a facial, and it's our goal that they never have to pay for their facial whenever they come to see us. They have enough going on at that period of time. So when Osmosis said, hey, we have a new device coming out and your oncology patients can even use it, we were so excited because this is a little bit more than just a standard facial. It is like a no-needle microneedle system. So it uses little spherical cones to sort of shake open the pores and allow that product to go in a little deeper. So it makes it a more clinically driven facial. The Osmosis line has lots of different powders that we can mix together to brighten, to help with wrinkles, to help with dehydration. So virtually any skin problem that's going on, we can address with the Osmosis facial. And now with this device, it makes it more a treatment that you're actually going to see a very nice result afterwards. But you're not going to be red. You're not going to have any downtime. So if you wanted to get pretty for an event, you're going to get a little bit more than a facial, but no downtime. So we're really excited about that. Now, after Sherry gets done with doing Devlin's other half of her face, she's going to do that Revitapin facial whenever we're done with tonight. So you guys can step over and peek at that later. We do have 2 oncology certified estheticians here. Sherry, look over and smile. Sherry Dursey is one of our oncology estheticians. LaTrinda Wilson is our other certified oncology esthetician. She couldn't be with us tonight. She probably left. Okay, and one other thing I wanted to tell you about, we have a new product from Revision. A lot of you love the IntelliShade. So the Revision product line has come out with a non-chemical sunscreen. This is a really big deal because we're not crazy about the chemicals that are in some of the sunscreens that are out there. They came out with one that has gotten rid of all of the chemicals, but it's still the incredible IntelliShade technology. So it will still protect, hydrate. It's still your makeup for a lot of people. It's your moisturizer and your SPF. I have one that I'm going to give away tonight. It is so new. It just launched yesterday, I think. So they were trying to rush the product and get it here to us, and it will be here tomorrow, Sam? Yes. Okay, so it'll be here tomorrow for you guys. I'm sorry, I was even trying to get samples. They didn't have enough samples to give us. So it'll be here tomorrow unless you're the lucky winner tonight, and then I bet you can raffle that off. And then I wanted to just mention our Youngblood Mineral Cosmetics. I know a lot of you know that we have the mineral cosmetic line. It is completely made of minerals. So there's no ingredients, no harmful ingredients, no fragrances in that. Sona Martinez, who is right now being a nursing assistant. Earlier, she was a microcurrent technician. She's our aesthetic concierge, and she's also an awesome makeup artist. So if anybody's ever interested, we can get you in for a consultation with Sona to get a color match or to let her help you put on the Youngblood makeup.